It is Thursday, April. Where are we, Dr. Dart? Is it April 29th?
29th.
29th, yes. And I'm City Councilor Kara Joy McKee. I am here with Dr. Bruce Dart from the Tulsa Health Department. And this is part of an ongoing effort to inform the public about what to do in the pandemic. We're moving maybe towards a new normal, right? Yeah, and been some good news this week. And so, Dr. Dart, I wanted to start out and ask you, are there things is there something that's still causing you a lot of concern?
Two things, and a trend we're seeing locally that we're also seeing nationally is that we're starting to see a downturn in vaccine uptake, and we know that we're not going to be truly out of this, and things won't go back to normal until we receive a certain level of herd immunity, at least 70% of Tulsa County vaccinated, and the state of Oklahoma vaccinated, and the only way we're truly going to be safe is to reach that. And with the downturn in vaccine uptake, that's just a little concerning. We've got to get people vaccinated so that we can have a natural barrier of transmission in the community. And then, I know there's lots of conversations about the mask mandate sunsetting after tomorrow. And yes, the data is looking really, really good. And I just don't want people to think that this is over, because it's not. It's important that people continue, even if you're fully vaccinated, continue to take the same precautions you've been taking, especially if you're in public places and indoor public facilities. Continue to mask, continue to social distance, continue to wash your hands. So we're in a much better position than we were previously, but this is not done yet. And the last thing I want to see is us spike that ball on the 5-yard line before we cross the goal line. So we've got to stay vigilant.
That's right. That's right. Yeah. And what do we have an idea about why we've seen this slow in vaccine uptake? I know it's not just Tulsa, it's not just Oklahoma. This is everywhere. What's going on? Do we know?
I mean, early on, of course, we know that the pandemic was very politicized, and I think that, so it's been polarized. I think that's part of the issue. And then, there's lots of misinformation about this vaccine. And yes, these vaccines were developed and manufactured at record levels of urgency and quickness. And I think that also leads to a little concern from individuals. But the data's been very clear, and that these vaccines are safe and effective. And even with the pause on Johnson and Johnson, we know that impact, while severe for some people, the number of adverse events it's still extremely low. So we're trying to get to the bottom of why people aren't being vaccinated. Now, we know that there's a big difference between people who are hesitant, who have concerns, and people who just flat refuse. So we're trying to be here. I appreciate opportunities like this to talk about these kind of things and answer questions about people's concerns, and really try to get to the bottom of why the hesitancy exists, because all of us, we have to make sure that we're doing the right thing for ourselves, and we provide information. I hope people use that information to inform what decisions they make, and hopefully we communicate such a way that's clear, and we answer people's questions and concerns, and hopefully that information prompts people to get vaccinated, because once again, until we reach that level of herd immunity, this pandemic is going to keep going. And I know that's the last thing everybody wants. Everyone's tired of this. I get it. We're all tired of it, but we all have to come together, and all have to do the same things and be consistent if we're going to get past this.
That's right. That's right. I was talking to some of my colleagues on council. Several of us were in the offices yesterday wearing our masks, taking them off when we were in our offices alone to still do the video meeting. And I was talking to Councilor Patrick, and she brought up the concern that she was worried that some folks don't realize that the vaccine is free, and that everyone over 16, everyone, regardless of immigration status, regardless of whether or not they have insurance, it's free and it's available for everybody. And I don't know if my constituents are worried about that, but she felt confident that some of hers are concerned, and that makes them a little bit more hesitant.
And we've been talking about that, and that's another way I think we need to look at how we're messaging, because from day one we've been saying that there's no cost to this. Now, I think some people have been confused because on some of the forms they do ask for insurance information, and at health department we give out vaccines, but if there's insurance involved with our clients and our patients, we do try and get an administrative fee, because this costs us money to do it, and it allows us to replace some of our costs. But if you don't want to provide insurance information, that's fine. We'll still give you a shot. If you don't have insurance, we'll still give you a shot. I mean, we've never charged a dime to the private citizen to receive these shots. So for them, it is free. And if we have the ability to recoup some of our costs, we're going to take it. If we don't have that ability, we're going to continue distributing vaccine anyway. So
excellent. You answered one of my other questions. Why collect the insurance information? So it's an opportunity for me as someone who has insurance to provide the opportunity for the health department to get reimbursed for the administrative cost. But it's nothing out of pocket to me. And if I hadn't provided that information, I would have got the shot anyway.
Well, good.
Yeah.
And I really appreciate Councilor Patrick bringing up these concerns, because if we don't know what concerns are, we can't respond to them. So the more that people let us know what issues exist out there, and what conversations maybe are floating in the community, we are happy to respond. And we're trying to be transparent and just stay with the facts, and that's what we'll continue to do.
Absolutely. And this is our first time doing this. So maybe between now and when I'm interviewing Dr. Clark next week, we'll get some more questions or some comments from the public. I certainly hope so. I hope people will email me at dist4@tulsacouncil.org or comment on this on Facebook once it's up there, and let us know what their concerns are or what they've heard. I had a family member say, I haven't really had time to go get it, and I'm not really around people very much anyway. And we had some conversation about, around anybody, anytime being, a concern. And one thing that came up was the lack of knowledge about how these variants come about, and that we all need to get that herd immunity to stop new variants from coming about. I think that piece of information had been missed. It's really scary watching what's happening in India right now, and it makes me feel that much more urgent about, we've got to get vaccinated. We've got to get everybody on board.
Absolutely. And of course, we know that vaccinations protect you, protect those around you, but more importantly, it prevents the virus from having an opportunity to have a genetic shift or genetic drift, which, that's what viruses do. When they infect someone, they replicate, and when they replicate, those viral particles, there could be a slight change in the DNA of that virus, and that's where our variants come from. So the DNA makeup is slightly different to the replication, and then once those viral particles actually start to leave that individual's body, through their respiratory passages and whatnot, then the virus is slightly different genetically, and then it infects one more person. There's one more slight viral change. So pretty soon these replications can keep going, are ongoing, and then we have a variant that's much differently than the original or the foundational coronavirus that started COVID-19. So that's, I think, another reason why people need to get vaccinated, so that we can prevent variants from occurring, because we know the variants so far are seem to be more highly infectious. They transmit a little bit easier. We're not really sure if it's dependent on the demographic, what that mortality morbidity could possibly be. So the only way that we can really protect ourselves again is to be vaccinated. Because the last thing we want to see is that constant replication, which produces variants, which makes it much more difficult for the vaccine to cover.
Yeah, and we don't know when a variant is going to come up that's going to be potentially more deadly for children. But that was another one of my colleagues, Councillor Dr. Wright, pointed out. Under 16, we still can't get those kiddos vaccinated, and right now they handle the virus fairly well, what we've got. But if it mutates into a variant that's a lot worse for kids, we could be in real trouble.
Absolutely. And good news is that at least Pfizer has completed their trials of the 12 to 15-year-old demographic. They have applied to the FDA for emergency use authorization, so we can start vaccinating that 12 to 15 age group. And there are ongoing trials now for 6 months to age 11 that hopefully we'll be able to start vaccinating those younger kids by this fall. But we're hoping to actually start vaccinating the 12 to 15 early summer. So which we really appreciate how the science has moved forward and has supported what we're doing, and has been our best tool to keep people safe.
Isn't that amazing? We'll look back years from now, and I think we'll see this was a marvel of modern science, that we got so much done so fast, people collaborating all over the world to get these vaccines developed, tested, and out there into the public. So I'm impressed with that as well.
It very much was a global effort, and we're getting so close to getting past this. Here in Tulsa County, as of yesterday, you know, 35% of our population was fully vaccinated. So we're halfway to herd immunity. 43% had at least received one dose. So, we're doing great. We just need to keep this up. And, if we've got much more opportunities for people to get vaccine. I mean, not only, through the health department, we now have the community vaccination center at TCC Northeast. Private provider, there's 331 private providers who have vaccine here in Tulsa County. So whether it be a pharmacy, one of our urgent cares, or your private provider. So there's great opportunity to be vaccinated. And everyone, we're urging everyone to take advantage of these opportunities. If you have issues, I mean, the most trusted people when it comes to talking about their medical history is your doctor, your medical provider. Call them, ask them these questions. Find out if they are one of the providers who are distributing vaccine, and go to them if that's where you feel safe. We just want to provide any environment where people want to be, and they feel safe, and they get served the way that they deserve to, and more importantly, that they get vaccinated, and a part of the process here for us all to move back to whatever normal is, and where we decide normal is going to be.
Right. We get to decide together.
Mm-hmm.
So yeah. And so what is the good news this week? I know that, we've been seeing the data trend in the right direction for a while, such that my colleagues on council have not felt it necessary to put forward an effort to re-up the mask mandate, and even yesterday the mayor has let us know that he's feeling comfortable letting go of some of the restrictions of the emergency order. Is that right? And tell me, if you would, what are those numbers, and how are they moving that makes us feel that comfort?
So, there are really metrics that result in us standing up to mask mandate in the first place. And, number one was our concern that our healthcare system was going to be overwhelmed. And, January, February, we were seeing literally 400 to 500 patients in our hospitals. As of yesterday, there are 58 patients in the hospital here in Tulsa County. 9 were in the ICU. And, I've seen rumors that these patients were in younger demographics, but according to the data, it's still the demographics that we've seen historically throughout the pandemic. So good or bad news, we're not seeing as many younger people hospitalized as what the rumors are saying, although of course they have been. But bottom line is that, as you know, the state now reports our data weekly. So, excuse me, as of our concern was that for example, if we got over 2 weeks of consecutive cases of 500 or more, we'd be really worried about more widespread transmission. Well, since mid-March, we've been getting consistently cases of 300 or so per week. Now, last week was our highest week. I think we had something like 428. But then this week we're back down to 276. So we've really been trending just slight up, had a little uptick, which I think was really due to, it's perfect timing from the Easter gathering. So, and then we're further back out from Easter now. And so we're down to, as I say, 278 for this week. So at least the case numbers are trending the right way. Where as I say, if we start to see like 2 weeks straight of over 500, we'd be concerned. And then another metric is that, our daily positivity rate, January, February, we were hovering in the 20 to 30% of daily positivities. We're below 5% now. Our concern is that we ever get over 10%, but we're nowhere close to that. And yes, testing is down, but still the testing that's being done is really, before we're just testing everybody. Pretty much now we're testing people that seem to have symptoms, and our positivity rate continues to be very low, which is phenomenal. And then I think more people might not know this, but we're also testing sewage outflow here for viral particles, and there's a threshold. If we get over that threshold of viral particles, that's a concern of more wide community spread, and we continue to be below the viral particle spread in our sewage, which is positive. And then if you've seen our zip code risk map, we continue to stay predominantly yellow. We're starting to get more green. I think we only have 2 zip codes in orange now, which is trends community spread. And so, we're so that the data is looking very, very good. And that's why I prefaced, our opening comments in that it's looking very good. But if people get complacent, if they take their foot off the gas, we'll see those numbers turn back up. And that's why it's important that just because the mask mandate might be sunsetting doesn't mean this is over, and doesn't mean that you should not bring your mask with you when you leave that front door.
Right.
It's important to keep protecting yourself, keep wearing that mask until we really reach herd immunity. We're
Mhm.
halfway there. you
Yeah.
know Now we have many more opportunity. We started vaccinating in December. We had just really small allotments back then. We have huge, we've been allotted over 400,000 doses of the vaccine. We've given out over 80% of that. It's easy to get vaccinated now, so
Right.
access shouldn't be a barrier for anyone now. So
Mhm.
we're actually also trying to work out some, if there's transportation issues, work out some process to procure transportation to the community vaccination center. So we're trying to eliminate every single barrier that we've had to people getting vaccinated, so that we can get at least that minimum of 70% herd immunity, and which I say we're about halfway there now. And if we can, if everyone steps up, our goal originally was to reach herd immunity by July 4th, and we were trending, we're on schedule. And the recent downturn uptake is concerning, because we want to get to normal, and we can't get to normal until we do reach herd immunity.
Right. So what would it mean taking our foot off the gas? It sounds like it would mean if we stop wearing our masks, that's going the wrong direction. If we
Yes,
keep trending down on numbers of vaccinations, that's that taking
yes.
our foot off the gas. What are the other behaviors that we need to keep that steady momentum?
And I think and it is somewhat confusing, because, for example, CDC just came out with new guidelines for outdoor. Basically, unless you're in a large outdoor gathering where you're packed in, you don't have to wear a mask outdoors. And but the mask regarding for indoors is still pretty much the same. Although there's been some CDC also said, if you're vaccinated, you can be indoors with a small group of fully vaccinated people and not wear your mask. And so it's like all these different layers of recommendations. I'm sure it gets confusing for people. I mean, heck, I'm in the middle of it. These new recommendations come every day. I'm like, you've got to stay caught up, and that's just not an easy thing to do. So, it's important that people going, especially to the public facilities, whether it be businesses or organizations, grocery stores, restaurants, that they continue to wear their mask. And for
Yeah.
restaurant workers, nationally, people that, for example, who work in restaurant bar, those who work in the back pretty much had no risk of exposure. It's those who are out working with the public that are risk for exposure, and they need to continue to wear their mask if they want to make sure that even if they're fully vaccinated, if we want to make sure that we're going to stop that trend of case count. So it's confusing. It's hard to stay on top of all the information because it changes so fast. We try and keep up with it on our website. I know that the council does as well. And so
Yeah.
we just hope people go to trusted sources for information. And if the information that they're looking for, if they can't find it on any of the sites they're looking at, call your physician, because we want to have a conversation with everybody that wants to talk about this, to answer questions and concerns, because we've got to get people vaccinated. And in the meantime, I've gotten calls from a lot of organizations who wonder if they should continue their mask policies. Tulsa Health Department, we're going to keep our staff masked indoors. We're going to
Mhm.
continue to ask our clients that come here to wear masks indoors, and
Yeah.
we would ask that everyone continue that recommendation until we reach herd immunity.
Yeah, I think that's most of City Hall as well. And certainly the majority of my constituents in District 4 tell me they are wearing their masks until it becomes really loud and clear that we can all take the masks off. They're wearing them, all the time. I know from my family and myself, anytime we're indoors, we're wearing our masks. And we actually haven't had the opportunity to be in close contact with a bunch of people outdoors. Probably won't have that for a few months yet. So, or maybe later this month, we'll see. But yeah, keeping an eye on that. I'm glad that weekly you and I, or Dr. Jennifer Clark and I, one of us, you two alternating, we'll have an opportunity to discuss this, because you're right, it can be confusing. I'm glad that people can call the health department. You all have been excellent with this. And what are some other signs of hope that you see? What makes you feel like we might really keep heading that right direction?
I I mean, I'll be honest, we never thought we'd be saying this early that we're halfway to herd immunity, which I think is extremely positive. We really wondered when the case, when cases trend, if that trend is true and the accurate trend, because the data changes so quickly, and I think we've done a really nice job of decreasing the lag between what's occurring and what's reported. And we have to continue that now. Another positive thing too is that the state relocated their state public health lab to Stillwater. They had that pandemic center there. They are starting to do genome sequencing for variants, so we get a much better idea of what variants are here, and more importantly, where the variants are at. And I think that's incredibly positive, because having that information allows us to make better decisions and inform our communities really what to be concerned about. And they have found several variants, and we've known that they've been here, but it's nice to actually start doing the testing to truly identify, so we know where they're at. So,
and I know you've been pushing them to do that genome sequencing. So I really appreciate you that you've been asking them, hey, let's find out. We'll do the test, and we'll find out for real where they are, what they are.
Yeah. But I think it's also positive that we've had the variants here. We know they're more highly infectious, but yet our numbers still continue. And that means people are getting vaccinated, wearing their masks, and so that positive activity is getting us to where we want to go. And so we want people to continue to do those, to follow recommendations, to still observe the 3 W's, so we can continue this forward movement, because we've come too far to stop now. We just have. And as tired and as exhausted as everyone is, we are so incredibly close. And it's like no one stops the marathon at the 26-mile mark,
Right, no.
So, and that's, and I just want that mindset for everyone to really be motivated and dedicated to do whatever it takes to stay safe and be part of the community staying safe. And that means masks and vaccinations right now.
That's right. That's right. And that gives me hope too. I also feel a lot of hope at how many outdoor activities there are this time of year. There's so much going on in Tulsa. You don't really need to go inside most of the time.
Mm-hmm.
You can go pick up some food from a local restaurant, go out to a park. You can go to Mayfest. You can go to all of these activities, marathons. You mentioned we're starting to have the runs again. People are out there, and those I feel really confident about recommending to people. Go out there to those outdoor activities where the air is flowing, where you don't have to wonder, is that person next to me vaccinated, because it's safer for all of us if we're outside. I'm looking forward to that being part of our new normal. Maybe we all spend a little more time outdoors. It's healthy for us. So.
I'm amazed. I'm a biker. I haven't had a bike as much as I used to, because of just so busy, but you go biking now, you see so many people on the trails. I go to my bike store, and it's like their inventory is gone. So people really, I think, are doing more things outside and doing things that will improve their health and health status. If there's been, I think, one positive from this, is that I think there's a greater awareness now of what health and health status truly mean, and the fact that there are things that we can do to actually enjoy it and improve our health and health status. And frankly, these things also help pump up our immune system, which protects us when we're exposed to infectious agents like coronavirus. So it's nice to see if we can get a community-wide shift, and to that more activity, people paying close attention to their diet, making better and more healthier choices. We're going to see a healthier Tulsa County, a healthier state of Oklahoma, because I think we all know where we rank nationally, and our goal here is to be the healthiest county in the country, and we've been trending in the right direction for years now. And not sure how the pandemic is going to impact that, but we hope to get back on track. Next 6 months, we truly do.
Excellent. Well, that's a great note to end on, Dr. Dart. I really appreciate you spending this time with me today. And I hear in a couple of weeks, you and I will be back here. I know Dr. Clark communicates with you, so we'll be getting more information from her in the same line next week with any updates that come, because as you mentioned, this is a constantly evolving situation. We're not out of the woods yet, but things are looking better, and that's great. We've needed some good news, right?
Absolutely. And so let's stay vigilant, and let's keep our feet on that gas pedal, and let's all get vaccinated, and let's go. I'll join everyone for a bike ride as soon as they're ready.
I love it. I'm on board. Count me in.
Okay.
All right. Thanks. Well, have a great day and take care.
You too. Stay safe. All right.
Will do.
Bye bye.
Bye.